Finally, here at 5:30 tonight, nationally, we're seeing a drop in opioid overdose deaths. Is that also happening here at home? This New York Times report says for 7 straight months, deadly overdoses have been declining nationwide. One potential factor is that for the first time in years, the Drug Enforcement Administration says fentanyl is starting to become weaker. We know fentanyl is behind a lot of the overdose deaths here in Western New York. Cherie Messore is Executive Manager of Development, Community and Government Relations for Spectrum Health and Human Services, and she joins me now live. Cherie, always great to see you. I want to go over a couple of numbers here to start this off. So through the end of last month, so 10 out of 12 months so far this year, we had 327 total overdose deaths in Erie County compared to 435 total a year ago. So if the trend continues, we are seeing a slight decrease. That obviously is something anytime to celebrate, right? But the number's still historically very high. How do you and your colleagues at Spectrum Health kind of size up the epidemic right now?
Well, that is true that there is that possibility that this year we will end the year with a few less deaths due to opioid overdose. And it's a combination of things of more education in the community, more outreach, more availability for things like the Narcan that you're showing now, test strips for testing drugs. So increasing harm reduction measures and encouraging more harm reduction measures too is also something that collaboratively Spectrum Health and the other peer organizations around the community are doing, and that is a contributing factor as well.
Yeah, Cherie, we don't know at this point how much a factor that change in fentanyl is. If the fentanyl isn't as potent as it used to be, and the thought is that the Mexican government is cracking down on this to an extent, and that may be helping. But talk to me about just how big a factor fentanyl is in the deadly overdoses that we're seeing. I mean, it's laced in so much of the cocaine, for instance, right?
It is. It's significant. And that is what is believed to be a contributing factor about something that's very surprising over the past few years. In the past year, deaths from overdose has really impacted people over the age of 50 significantly, and even over the age of 60. Last year, 46% of overdose deaths were attributed to people over the age of 50 and 24% over the age of 60, which is dramatically different from where it was a few years ago. And there's a thought now that people of that age who perhaps were using party drugs back in the 80s have begun using again. Their bodies are different. Our bodies react differently to drugs and to any level of medication as our bodies change in age. And also that drugs now are so much more potent than they were back in the 80s too. So that was a surprising statistic. There's another surprising statistic too, is that the number of African American deaths is significantly overrepresented in overdose deaths. It's about 14% of our population, but a third of the deaths are attributed to folks who are African American. So that combination of the change in age and the shift in who is using and how they're using, it was a contributing factor to the growth. But hopefully this combination of education and harm reduction is helping with that idea that the trend could be changing. One of the things that we're finding too at Spectrum Health, we're the third year of a 5-year medication-assisted treatment grant, and we're doing a lot more outreach in the community. And we found through our research that people who are staying connected in services are reporting a reduction in their overall substance use and some improvement in their life satisfaction as well.
It's so important. Cherie Messore, I wish we had more time with Spectrum Health and Human Services. Thanks so much for coming on and talking to us about this.
Thank you so much.